Well, the initiative is called Not Suicide, Not Today. And the goal is to save lives by changing the conversation around suicide. The team at the Center for Addiction and Mental Health also wants people to know help is there.
5% of all suicide deaths are men.
For women, the attempt rate is 3 to 4 times higher.
Transgender and gender diverse people are at a greater risk than those who are cisgender.
These are the stats, and it's time we change them.
Over 75%.
Well, let's go back to transgender Canadians. Accessing and receiving proper care can be especially difficult for them. Our next guest is working to change that. Alex Abramovich is a scientist with the Institute for Mental Health Policy at CAMH. Good morning to you. Thanks for being here.
Good morning. Thanks for having me.
All right, so let's start with Not Suicide, Not Today. The campaign is so important, so crucial right now, especially for transgender Canadians, isn't it?
Yes, absolutely. There's still so much stigma and shame with regards to mental health issues, particularly around suicide. And, these are issues that impact all of us in different ways. Some of us are at higher risk than others. So, for example, transgender individuals are at, significantly higher rates of mental health issues and suicide. And this is often due to stigma and discrimination. And, even though we know this, still there is a major lack of awareness and a major lack of research with regards to the trans population.
Okay, well, let's drill down on that. Trans people have been understudied for such a long time, especially when it comes to mental health. Talk to me about the trickle down effects, the ripple effects. If the transgender community isn't properly studied and the impacts aren't properly studied, what effects does that have later on when it comes to accessing care?
Yeah, absolutely. When trans people are not included in research, it actually results in a situation in which trans people are erased. So, for example, we have surveys and we have institutional forms, such as the forms that we have at the doctor's office in healthcare settings. And when these forms don't include trans identities, but rather force everyone to fit into, either female or male categories, and sometimes there might be a checkbox with the word other next to it, which actually doesn't tell us anything about a person's identity. And, like being realistic, who wants to check off a box that says other? These are the kinds of situations that actually result in trans people becoming invisible in these types of settings. And, when you're told over and over again that you don't exist and that your identity is not real, then eventually you begin to believe that. And you can only imagine what that does to a person's mental health.
No, you're right. I can only imagine it. You are right now in the midst of trying to bring solutions to bear on that very problem by completing the first phase of a very large study looking into trans people in this country and how they access mental health care. What have you learned so far?
Yeah. So, for nearly 15 years, I've actually focused my research on issues regarding LGBTQ2S youth homelessness, which continues to be a significant issue across Canada. But more recently, I've started to focus on trans health. And so as you said, I recently led a study that focused on the health of trans people and that looked very closely at the way that trans people access the healthcare system. And so my team and I worked closely with a variety of health clinics that actually ask inclusive questions, right? And so they actually ask all of their patients about gender identity. So they collect information regarding, who's trans and who's not. And so because of this, we were able to identify a large sample of trans people in Ontario. We identified 2,085 trans people, which is quite significant given how difficult it is to identify trans people in the healthcare setting. And this is certainly one of the first studies of its kind in Canada. And so using this data, we were able to look at the health outcomes and look very closely at how trans people access the healthcare system. And what we found was that among trans people, there were significantly higher rates of mental health-related healthcare visits. So mental health-related primary care physician visits, psychiatry visits, and mental health-related hospitalizations and emergency department visits. And, honestly, it's really no surprise that transphobia and all of the discrimination and stigma and violence that comes along with it is really bad for our health.
Alex, it's a really important work that you and your team are doing, so please keep it up. We wish you the very best.
Thank you so much.
And for more information about CAMH's Not Suicide, Not Today campaign, head to their website, camh.ca. And if you or someone you know has suicide-related concerns, please reach out to the Trans Lifeline or the Canada Suicide Prevention Helpline. And we have those numbers up on the screen right now, or please call 911. CAMH also has a number of resources on their website as well.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.